Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform plastic or cosmetic aesthetic plastic surgery. I do a lot of Brazilian butt lifts, and it's a very hot topic now. Last year in my practice and overall across the country, it was the highest increase percentage-wise of procedures in the last year. People kind of want to know, with regards to Brazilian butt lifts, a common question, as with any surgery, Dr. Shapiro, what are the possible adverse side effects from Brazilian butt lifts, and what are the major risks with regards to surgery? There are general risks in surgery no matter what procedure I do, and commonly these are things like infection, the risk of anesthesia, something called a hematoma, which is a blood collection, and those are the common surgical risk that everybody faces whenever I do surgery. Generally, these Brazilian butt lifts are performed under general anesthesia because I think it makes you much more comfortable and allows me to concentrate aesthetically and artistically on what I'm trying to accomplish. The Brazilian butt lift is not a very long procedure, hence the anesthetic risk is quite low. Usually the procedure takes me about an hour to an hour and a half. With regards to bleeding, we like to have you stop anything that causes bleeding in your diet, stopping some non-steroidals, like Motrin or Aleve. We like to have you stop aspirin. We like to have you stop a lot of things that can cause bleeding that are herbal or over-the-counter nutritional supplements. Those can be vitamin E, fish oil, garlic. There's a whole slew, and we'll give you some information about what to avoid. Infection is incredibly rare, and in my practice I've never seen anybody with an infection after Brazilian butt lift, but I guess it could happen across the board statistically. Now, there are some inherent risks that I see with Brazilian butt lifts, and the first thing is called a seroma. A seroma is a fluid collection below the skin where I've evacuated fat or possibly re-injected fat, and that's just a collection, if you will, the fluid that surrounds the blood. And basically, because of the fat and because of the normal recovery process, people can and do form seromas. So what do I do if that happens? I generally will aspirate that with a small needle in the office, and that seroma will go away. If it is not addressed, generally that seroma could cause some scarring, and you could actually feel some effect of that postoperatively. So we want to avoid that. Another very rare complication is something called a pulmonary fat embolism, and we try to avoid that by just performing that procedure with the utmost expertise. Along the lines of any liposuction or Brazilian butt lift procedure, there is an increased risk of something called a DVT, which is a vein clot. And of course, the risk of having a vein clot is that can travel to other areas of your body and be a real serious problem. Again, in my practice, the DVTs are very, very low. I will give you something to thin your blood before the operation and sometimes after the operation, along with putting some compression boots on your legs to minimize the risk of that happening also. And lastly, there is the risk that some of this fat will reabsorb. In my practice, that's very, very rare. But the good news is that secondarily, if we had to inject some more fat, generally that can be performed in the office under local anesthesia. There's not much fat generally that needs to be put in. Overall, I think the Brazilian butt lift procedure is a very common one. It's one that makes people happy. I think it restores that sense of aesthetic proportion to people in terms of what they're looking for. I think it's a very low-risk procedure, and I think it's a really wonderful addition to my surgical practice. The best way to get an idea of whether you're a good candidate for a Brazilian butt lift is come in for a consultation and get an idea. Thank you.